According to the latest Children's Climate Risk Index, as many as 2 billion children worldwide are now exposed to at least one climate-related hazard, whether it's rising temperatures, floods, cyclones, drought, or toxic air. These environmental shocks threaten children's education, nutrition, physical safety, and more dangerously, their cognitive and emotional development. Dr. Hilda Mantebiaboy is the president of the Pediatric Society of Ghana.
If you have a mother and a child, a family, and because of this flooding, they become displaced, that's a big problem. What it also means is that it can affect the schooling of the child. The child may miss some days of school, opportunity to learn and do well. The mother herself may not be able to work, opportunity to earn an income is lost. They are children. Their bodies are not that developed or that matured. Their immune system is not well developed to be able to fight infections. Physically, they are smaller, so their ability to even run when necessary, they may not be able to do. The effects of the heat on them, if there's a heat stroke.
Global health agencies reveal that pregnant women exposed to prolonged heat waves face increased risk of giving birth to babies with congenital heart defects. Meanwhile, polluted air, laden with particulate matter from vehicles, burning waste, and industrial emissions continue to fuel respiratory infections, asthma, and other life-threatening complications in newborns. Dr. Emmanuel Tremanting Amoa is a health specialist at UNICEF.
If we're able to commit as a country and join hands with partners and actually implement what we've put out in the NDC3, I think Ghana should go up, including gaining some funds from green climate exchanges where we can contribute positively to reducing the carbon emissions in the country. So I think, if we commit to it, Ghana will do well in terms of its adaptation and mitigation of.
Each year, around 8 million children are born with birth defects. 94% of severe cases occur in low and middle income countries, many of them in sub-Saharan Africa. In many rural communities, women and girls already carry the heaviest burden, walking long distances under scorching heat to fetch water, firewood, or food. The constant exposure puts them at even greater risk, deepening gender inequalities and undermining family resilience in the face of climate-related emergencies. Spotlighting the issue on the German Embassy-JoyNews Climate Talks at Kolebu in partnership with the Pediatric Society of Ghana, speakers stressed the threat while advocating policies to reducing it. Head of training at Ghana's Ministry of Health, Tony Goodman, had this to say.
Climate change has affected health delivery. It has changed our policy. We have now moved away from what we're looking at in the past, and now health workers are facing the blunt. Yeah. Because you go to work, you are expecting some number of persons to appear. But unfortunately, you have an increase in numbers. And I know my colleague nurses will tell you, you go to work and you're overwhelmed by what you see. That is why this center is picking up the diseases before they get to facilities.
Right. Climate change is also crippling healthcare systems. Hospitals are overcrowded. Health workers are stretched beyond capacity, and essential medical supplies can run short during climate disasters. Dr. Frank Osusetre is the medical director of Kolebu.
Almost always, children are battling one respiratory tract infection or the other. All of these have been attributable to the climate change. We also know the effects of the indirect effect of flooding on the family setting. And here, the women are always bearing the brunt.
In 2023 alone, extreme weather event displaced over 43 million children globally, forcing many into camps and unsafe areas with limited access to medical care. Experts say urgent action is needed, from investing in climate-resilient healthcare systems to protecting pregnant women and children from environmental hazards. you.